So today we're diving into a medical malpractice case, and this one really highlights the importance of staying updated on medical standards and guidelines.
Absolutely. And, this one hits close to home because it involves something that could happen to any of us. We're talking about complications from vascular access devices, specifically catheters.
Right, and you requested a deep dive on a case about a catheter that wasn't placed properly.
Yeah.
So let's get into it. This case revolves around a 36-year-old man diagnosed with Lyme disease, which, as you know, is pretty common.
Yeah, Lyme disease is unfortunately becoming more and more prevalent.
Exactly. So he's prescribed intravenous antibiotics, which seems pretty standard, right?
Oh, for sure. Many people require IV antibiotics at some point.
But this is where things get a little complicated. To administer the antibiotics, he needs a peripherally inserted central catheter, or as it's more commonly known, a PICC line. Sounds pretty straightforward, right? Just a way to get those meds directly into his system.
Well, PICC lines are definitely designed for longer-term intravenous treatment. We're talking weeks, sometimes even months.
Okay, so nothing out of the ordinary so far.
Not really, no. They inserted the PICC line into a vein in his arm, and it's supposed to thread up until the tip reaches a larger vein near the heart. That's the goal, at least.
It sounds like a procedure where precision is key, wouldn't you say?
Absolutely. There's very little room for error here. And that's where things get interesting from a medical standpoint, at least. You see, there's a standard protocol for this type of procedure, and it involves using an X-ray to make sure the PICC line is positioned correctly and hasn't caused any damage. However, in this case, the hospital decided to deviate from that standard practice.
They didn't do an X-ray. Why not?
Well, instead of using a standard PICC line, they opted for what they called a mod PIC. It's a slightly different type of catheter, and sometimes, though not always, the placement protocol doesn't require X-ray confirmation.
So they used a different type of catheter and didn't verify its location.
Unfortunately, yes. And this is where things start to unravel. By not confirming the placement of this mod PIC, the hospital was already deviating from the established standard of care. And as we'll see, this decision had significant consequences.
So, red flag number one. They're using a different type of catheter and not verifying its location. What happened next?
Well, after 19 days with this mod PIC, the patient started experiencing complications and needed emergency treatment. It turned out that his catheter was blocked, a condition known as an occlusion.
An occlusion. What does that mean exactly?
Basically, it means there's a blockage in the catheter preventing medication from reaching the patient. And as you can imagine, that's a pretty dangerous situation. So we left off with our patient ending up in the ER, his initial catheter blocked, and the medical team trying to figure out their next move.
It's a situation that calls for immediate action, wouldn't you say?
You would certainly hope so. In this case, they decided to insert a second mod PIC, this time in his left arm. But almost as soon as they did, the insertion site began to bleed.
Okay, well, a little bleeding at the insertion site isn't that uncommon, right?
You're right, some minor bleeding can occur, but this wasn't a small amount. We're not talking about a little oozing here. The nurse's notes describe the bleeding as significant and persistent.
That's not good. That doesn't sound like a minor side effect. This is a serious complication.
Exactly, and the nurses were clearly concerned as well. Their notes document oozing, catheter migration, even blood on his clothing.
This is alarming. It seems like things are escalating quickly. Did they call the doctor right away?
Well, this is where the communication starts to get a bit murky. There were delays in contacting the physician and even conflicting advice given to the patient about how serious the bleeding was.
Wait, are you serious? They were downplaying the severity of his condition while his arm was bleeding profusely.
Unfortunately, that seems to be the case. Some nurses downplayed it while others were clearly documenting the severity.
I can't imagine being in that situation. What was the doctor's assessment when they finally got a hold of him?
Well, that's just it. It's unclear when the doctor was actually brought into the loop. The timeline is fuzzy and the records are incomplete. This lack of clarity only adds to the complexity of the case.
So the bleeding continued with no clear direction from the physician, and I'm guessing the patient's condition worsened.
Tragically, yes. His symptoms continued to escalate. He was experiencing significant pain, swelling, and discoloration of his arm.
This is beyond a simple infection at the insertion site. These are serious complications.
Absolutely. And after days of enduring these agonizing symptoms, he was finally diagnosed with not one, but two serious conditions. Deep vein thrombosis, which is a blood clot, and thoracic outlet syndrome, a compression of the nerves and blood vessels in the space between the collarbone and first rib.
This poor man went in for a routine procedure and ended up with potentially life-altering conditions. It's a stark reminder of just how critical it is to have clear communication and adherence to safety protocols in a medical setting.
I couldn't agree more. What happened to this patient is tragic and, unfortunately, highlights the importance of advocating for yourself in a medical setting.
So we're left with a patient facing a long and difficult recovery, his life completely upended by what was supposed to be a routine procedure. What happened next? Did he just accept this?
Well, this is where the story transitions from a medical tragedy to a legal battleground. Understandably, the patient was frustrated, he was seeking answers, and he decided to take legal action.
I can only imagine. But suing a hospital? That's a big step. What ultimately led him to that decision?
It's important to note that this wasn't a rash decision. It wasn't driven by anger or revenge. The patient actually did something quite remarkable. He decided to investigate the matter himself.
He took it upon himself to get some answers.
He did. He delved into the medical literature, researching PICC lines, their placement, the standard protocols, everything.
So he essentially became an expert on his own misfortune.
In a way, yes. And through his research, he made a startling discovery. He discovered that the hospital's actions every step of the way, from the initial decision to use the mod PIC without X-ray confirmation to the delayed response to the bleeding, all of it pointed to a significant deviation from the established standard of care.
There's that phrase again, standard of care.
Yeah.
It seems like this is the crux of so many medical malpractice cases. But what does it actually mean in a legal context?
You're right. It's a pivotal concept. Essentially, standard of care boils down to what a reasonably competent medical professional practicing in the same field with similar resources would have done in that same situation. It's not about demanding perfection, but it is about adhering to accepted medical practices.
So in this case, the patient believed the hospital failed to meet that standard.
Exactly. And the compelling part is he had the research to support his claim. He found national standards, position papers from organizations like the Association for Vascular Access, all emphasizing the importance of X-ray confirmation for PICC line placement, especially in cases involving a mod PIC.
So these guidelines, they're not just suggestions. They carry real weight in a legal setting.
Absolutely. They represent a consensus among medical experts, a distillation of best practices based on years of research and experience. In court, they're incredibly persuasive because they clearly demonstrate what the medical community considers acceptable practice.
So what happened next? Did he immediately file a lawsuit?
Actually, he attempted to resolve the issue amicably. He approached the hospital, presented his findings, and expressed his willingness to forego legal action if they agreed to, at the very least, update their practices and procedures. His goal was to prevent this from happening to someone else.
It seems like an incredibly reasonable request. Was the hospital receptive to his proposal?
Unfortunately, no. The hospital, for reasons that remain unclear, refused to acknowledge any wrongdoing and wouldn't commit to making any changes.
So, left with no other recourse, he filed a lawsuit. Who are the defendants named in this case?
The lawsuit named the hospital, of course, but also the home health agency that provided some post-procedure care, the certified registered nurse infusionist directly involved, and surprisingly, even the manufacturer of the PICC line itself.
They really went after everyone even remotely involved. Was that really necessary?
It might seem excessive, but it's actually a common strategy in medical malpractice cases. By casting a wide net, the patient's legal team aims to explore all potential avenues of liability and determine who might have contributed to the harm he suffered.
So it's more about due diligence than pointing fingers.
Precisely. And often when facing a lawsuit, some parties choose to settle out of court, which is exactly what happened in this case. Everyone except the hospital settled.
Leaving the hospital is the sole defendant at trial. So the stage is set. You have the patient seeking justice and compensation for the life-altering injuries he sustained. And on the other side, you have the hospital facing serious accusations of negligence.
Exactly. And at the heart of it all was this concept of standard of care, with the patient's legal team arguing that the hospital's failure to adhere to the standard directly led to his injuries. The trial ultimately hinged on the central issue.
And what was the jury's verdict?
After hearing both sides, the jury found the hospital 55% liable for the patient's injuries, awarding him $7.1 million in damages.
$7.1 million. That's a significant sum. What kind of message does this verdict send? Not just to this hospital, but to the medical community as a whole.
This case serves as a powerful reminder that even seemingly minor deviations from established medical standards can have devastating, life-altering consequences. It underscores the absolute necessity of staying up to date on the latest research, guidelines, and best practices. The medical field is constantly evolving, and healthcare professionals have a fundamental duty to their patients to remain current in their knowledge and skills. This case highlights how crucial that really is.
It also emphasizes the importance of patients advocating for themselves. I mean, this man took the time to research his own condition, he advocated for himself, and ultimately he brought about changes in the hospital's practices. He turned a very negative situation into something positive.
You're absolutely right. His determination and his actions serve as an inspiration to all of us. It reminds us that we need to be proactive in our healthcare, asking questions, seeking second opinions, and most importantly, speaking up when something doesn't feel right.
Knowledge is power, especially when it comes to our health. This deep dive has been incredibly insightful, reminding us that while we place our trust in medical professionals, we also have a responsibility to be informed and engaged participants in our own care.
Well said. This case, as complex as it might seem with the medical details and the legal ramifications, really boils down to a simple but profound truth. Medical errors can have devastating, irreversible consequences, but by adhering to these established standards of care, we can strive to create a safer, more effective healthcare system for everyone.
And that's why we do these deep dives. Thank you for joining us for this exploration of a medical malpractice case that had implications far beyond the courtroom. We hope this has provided you with valuable insights and sparked some important conversations about patient safety, medical ethics, and the ever-evolving landscape of healthcare.